many places and still rising. But today we have hope on the way. Supplies of an FDA-authorized, safe, and effective COVID-19 vaccine are arriving at sites across America. Vaccinations begin today, as soon as healthcare workers are ready to start providing them. America is one of the very first countries to roll out a safe and effective vaccine for this virus, and America has played a greater role than any other in getting the world to this point. President Trump's Operation Warp Speed has helped bring us a medical miracle. Substantial quantities of a safe and effective vaccine within a year after the virus was first known to the world. I want to thank the President for his bold vision, for his unwavering support of Operation Warp Speed, and for bringing together all of America, HHS, the military, the private sector, and the states to make this happen. This week, everyone's work starts to pay off. This weekend's shipment of vaccines is 2.9 million doses, enough to vaccinate 2.9 million people, with 2.9 million doses held back and sent in 21 days for people to receive their second dose. Each Friday from here on out, we will announce new weekly allocations of vaccine. It's likely that another vaccine may be authorized in the coming days if it meets FDA's rigorous standards. Pending the successful authorization of other vaccine options, we have enough vaccines already purchased to ensure we can meet our goal of vaccinating every American who wants it by the end of the second quarter of 2021. We continue to negotiate for and purchase more doses too, including the announcement of another 100 million doses of Moderna to be delivered in the second quarter of 2021. States and other jurisdictions have decided who will be vaccinated in the early stages, drawing on their own best judgment, their own situation, and the recommendations of experts. These jurisdictions will generally be using these first doses to immunize frontline healthcare workers, along with residents of long-term care facilities like nursing homes and assisted living facilities. Today, the CDC distributed another $140 million in funding to states to continue planning efforts around allocation. Operation Warp Speed is taking care of the cost of the vaccines themselves, the ancillary supplies like needles and syringes, and the cost of distributing the vaccines to jurisdictions, while healthcare payers are handling administration costs so no American faces an out-of-pocket expense for this vaccine. These jurisdictions have given us the locations where they want vaccines shipped. In total, 636 sites nationwide, with 145 sites expected to receive vaccine today, 425 tomorrow, and 66 sites on Wednesday. As we speak, vaccine is arriving at sites and in trucks and planes owned by UPS and FedEx to bring these life-saving products to the places where Americans will receive them. By Wednesday, vaccine will be delivered everywhere from sites here in Washington to the shores of Guam to the northeastern corner of Maine. Here in Washington, members of our military, HHS public health leaders, and private sector partners are running an operations center 24/7, where many of them have been essentially all weekend, to ensure these vaccines get where they're supposed to go without delay. Americans who may be in these early categories of healthcare workers or those in long-term care facilities should look for information from their state governments, like their state COVID-19 webpage, or for guidance about where and when vaccinations would occur. We know Americans will want to know how quickly vaccines are being administered and what kind of progress we're making. We want to ensure that any picture we give of this progress is accurate, and we plan to provide more updates on our work with states to provide as much information as possible in the coming days and weeks. Like so many Americans, I eagerly await the day when I can go receive a safe and effective vaccine, and the day when my family can do that too. In the coming weeks, I and all of our public health leaders across the administration will be out making a major push to educate Americans about the incredible safety and effectiveness of these vaccines. This FDA-authorized vaccine, and each vaccine FDA potentially authorizes, will have been through the typical numerous stages of safety review and more. This vaccine has gone through clinical trials much larger than many vaccine trials. It's gone through the drug company's checks. It's gone through an independent data safety and monitoring board. It's gone through the FDA's independent advisory committee. It's been subjected to transparent standards that the FDA has published of its requirements, and it's been authorized by FDA's career scientific experts. At 95% efficacy, this vaccine is extraordinarily effective at protecting you from this virus. Getting vaccinated will help keep you, your family, and your country healthy and safe. In the meantime, and in the coming months as our country approaches full vaccination, we have to continue taking steps to keep ourselves, our loved ones, and our community safe. Wash your hands, watch your distance, wear your face coverings when you can't watch your distance, and avoid settings where you can't do those things or where you may let your guard down. Every sacrifice you make in the coming months will help save lives and ensure that we emerge from this pandemic as soon as possible. Each vaccine administered in these coming days is a tribute to the generosity and genius of this country. The achievements of every American who made Operation Warp Speed possible should be a point of pride for us all. Our war against the virus is not over yet, but this week we're taking a major step toward our eventual victory. With that, I'll hand things over to Dr. Moncef Slaoui to provide an update on development, and he will then turn to General Perna, who will give us a more an in-depth update on vaccine distribution. Dr. Slaoui?
Thank you, Mr. Secretary. Hello, everybody. Well, just very, very quickly, first acknowledge a historical event last week with the approval of the Pfizer vaccine. I think a great accomplishment by science and the investment in basic research, a great accomplishment by academic science, by science and development in biotech industry, in the pharmaceutical industry, and a great public-private partnership as enabled by the US government. So really, I think great job. But yesterday was just a first step with the Pfizer vaccine approval. This week, probably tomorrow, the booklet for VRBPAC review of the Moderna vaccine will be made public, and many of you will have an opportunity to look more in depth into how remarkably aligned with the Pfizer data the Moderna data are, also with almost 95% efficacy against disease, 100% efficacy against severe disease, and more for you to review tomorrow. That booklet and the vaccine will be reviewed at the VRBPAC meeting by the FDA on Thursday, and hopefully, as for Pfizer, diligently followed up by potentially an approval of the vaccine and distribution. We have ensured significant commitment in terms of vaccine dose availability from Moderna, with 100 million in the first quarter and a second 100 million announced on Friday in the second quarter of 2021. We are in active discussions with Pfizer to similarly extend the number of doses available for the American population. But things don't stop there. You know that we have two other vaccines in phase 3 trials, the Johnson & Johnson, Janssen's vaccine, a one-shot vaccine. We now are almost at 42,000 subjects recruited in the study, so slightly more than the cap we announced last week. The study will stop recruiting later this week, and given the intensity of transmission in the US and in the other countries where the trial is being conducted, we definitely expect to have first readouts of that trial in the first parts of the month of January, and likely potential complete readout of the trial towards the end of the month, and submission of an EUA. Vaccine doses from the J&J vaccine will, if approved, start to participate to immunizing the US population in the month of February and going forward. And because it's a one-dose vaccine, they can really scale up very quickly the number of US vaccinees that would be immunized. The fourth vaccine that we have in the portfolio that's in phase 3 trials is the AstraZeneca vaccine. You know that vaccine has undergone phase 3 trials in the UK, in Brazil, and in South Africa, but also under Operation Warp Speed. We have conducted a clinical trial mostly here in the US. We have more than 22,000 subjects recruited in that trial, and that trial should also be completing its first efficacy readout somewhere in the probably second half of the month of January, and potentially be ready for an EUA submission later in February, and again participating with vaccine doses in the month of March and going forward. These are the reasons why we feel confident, provided that the vaccine's performance remains on the path that we are on, that we will be able to have enough vaccine doses to immunize the US population. There's 2 points I want to say in conclusions. One is, it's very, very important now that vaccines are approved in the US that Americans continue to act in a generous way, in that they would continue to participate into clinical trials. It is thanks to the participation of tens of thousands of Americans in the Pfizer and the Moderna trials that we are able to have these vaccines approved today, and that we are able to assess their efficacy and their safety. And likewise for the Janssen's and for the AstraZeneca trial. We have 2 more vaccines in the portfolio using more classical protein-based vaccine platform technology. Please continue to participate in the trial. These vaccines are very likely to be as effective as the vaccines that we know already, and as safe as those vaccines. It may very well be that participating in the clinical trials could be the fastest way to access vaccination. You know that we are doing the best we can in terms of providing vaccine doses, but these are rolling in the few millions per week. Participating in a clinical trial may allow you either immediately to have a vaccine dose, or immediately on completion of the trial, if you were on the placebo group, to have a vaccine injected. And the second key point is really to continue our engagement and all experts, real experts, engagement with the population to explain the data now that the data is available in public, that demonstrate the efficacy and the safety of these vaccines. It's very important that we increase the number of Americans that accept to be vaccinated based on facts and data and reality, because vaccines on a shelf are useless, and unless the large majority of us gets vaccinated, we will not be able to control this pandemic. I'll stop here and pass on to General Perna, who will tell us more about distribution.
Dr. Slaoui, thank you, and of course, Mr. Secretary, thank you for allowing me to be a part of this. And just to come off of Dr. Slaoui's last comment, on Saturday I mentioned, I was asked who was going to be the first one to receive the vaccine, and my comment was, we've had over 100,000 people participate in trials. They were the first ones to receive the vaccine. They were the heroes to really help us get going. So I would applaud them, to Dr. Slaoui's point. Continuous effort in that will be so helpful. So update, first and foremost, Pfizer vaccine. After EUA on Friday, a lot of work was happening over the weekend by thousands of people from Pfizer, UPS, FedEx, and McKesson to ensure that the vaccines were packed and ready to be shipped in a very methodical, disciplined, overwatched approach, right? Our goal is every vaccine that goes out is safe and effective upon delivery, and we wanted to make sure that deliveries occurred in the places where people could receive them and then begin administering vaccine to the American people. It went incredibly well. As I talked to you about a lot of detailed planning and execution to this point, our goal is, our strategy is simple. One, the Pfizer vaccine initial push, based on what was available, we wanted to get out to American people right away. I briefed the cadence that we would pack on Saturday, that we would relocate on Sunday, and we would deliver on Monday. Deliveries have begun today as we speak. Of the 145 shipments the Secretary referenced, we know that 55 have been received, and we'll track the remaining 95 accordingly as we go through the day. We know that the shipments for tomorrow's deliveries have already been packed and checked, and we'll be managing each of those to include Wednesday's shipment. Now, that's the initial 636 shipments that went out for the Pfizer vaccine. We have already identified the follow-on orders for Pfizer vaccine, and there will be an additional 581 shipments that will continue on beyond Wednesday, Thursday, Friday, through the weekend in delivery to the American people. The point being, it was the initial push that we were fully driving execution, and now we're starting our drumbeat of continuous execution of vaccine. As it is available, it's allocated to the states. The states tell us what location they want it on, at what quantities. We package and we deliver. It is a constant flow of available vaccine. Clearly, the next vaccine that we're looking forward to EUA this week is the Moderna vaccine. And in that light, we know that we're going to ship just a little bit short of 6 million doses out to the American people. And we're shipping it to 3,285 locations across the country. It'll be a very similar cadence that was executed this week with Pfizer, where we're hitting initial sites on Monday, follow on Tuesday and Wednesday, and then by the end of the week, we're just in a routine cadence of execution. I cannot tell you enough, right, what role commercial industry is playing in this, right? Pfizer, eventually Moderna, right, and the work that they're doing to get the vaccine prepared for final distribution. McKesson in the distribution of all the ancillary kits for the Pfizer vaccine, which included syringes, needles, alcohol wipes, and diluent. And then they will also be responsible for kitting the vaccine for Moderna, right? So really a remarkable work. And then FedEx and UPS. I just can't say enough to the men and women of FedEx, from the leadership all the way down to the persons moving packages from storage capability onto trucks and planes, and then the pilots who got it out to where we needed it. As the Secretary said, there is not one part of this country that's not being touched today through Wednesday. Everybody is receiving fair and equitable distribution of the vaccine, and it's because of the commercial industry and the role they're playing in the distribution of the vaccine. We're incredibly excited about the strategy. We are continuing to provide states with future forecasts so that they can continue to plan. Our forecasts go from next week through the following 6 weeks for planning. As I said, we will only release vaccine once the FDA has approved it. So forecasting helps for planning, but execution is only based on approval. And then we share those allocations with the states for their planning on a weekly basis. Again, to reinforce, it is not a one-and-done delivery. It is a consistent flow of ordering, preparation, and delivery. So vaccine continues. It rolls out as vaccines are available, and more people get access to the vaccine every day. Mr. Secretary?
Thank you, General. We'll open for questions now.
So thank you all. Operator, we're ready for questions. A friendly reminder that when asking a question, please state your name and publication, and please keep your questions as short as possible so that we can get to as many questions as possible.
Thank you. Our first question comes from Angelica Lavita with Bloomberg News. Your line is open.
If you're talking, we can't hear you.
Sorry, can you hear me now?
Yes.
Okay, thank you. So when will vaccination of long-term care facilities begin? And if not until the 21st, why wait a week to start those vaccinations?
General, you want to?
Yes, please. So thank you. So, of course, we're working through the state's plans, right? And the guidance that was put out was long-term healthcare facilities / nursing homes as one priority, but as well as the first-line medical personnel who are out there. So allocations for vaccines went out to the states, to the locations that they directed, and they are identifying in those populations who is first. Here's what we do know. We know that several states are already going to establish, or have already established, and then going into long-term health care facilities. They'll go in there this week. We know that the CDC, in collaboration with CVS, Walgreens, and the states, created a very elaborate campaign strategy for execution into the long-term health care facilities. This week, we are doing a scaling start into execution. 4 states are ready to go in partnership with CVS and Walgreens to start scaling the vaccine into those facilities. We know on Monday, a week from today, over 1,100 long-term health care facilities and nursing homes will also begin vaccination. So very incredibly difficult plan as we work to touch over 70,000 long-term health care facilities and nursing homes, collaborated and prioritized as the states want. Many tasks have to be achieved before you can actually walk into the door. You have to work through, make sure there's locations in the facilities to do it. You have to make sure that all the patients have a signed consent, which means sometimes you have to reach out to several layers of family to get the final approval. We have to ensure that we have the right number of vaccine available to go into each of the facilities so we're not going back and forth. We have to ensure that the persons, not only the elderly, but the staff can be inoculated at the same time, so we close the bubble on each facility. So very detailed plan, very extensive requirement of over 70,000. States are already executing, are going to execute this week, and we are executing the scaled start with CVS and Walgreens this week. The bluff is, if they want to do it, we can figure out how to get it done. But we are ready to really take a good, hard, right approach to executing and taking care of these great Americans that are in the elderly category.
And just one extra clarification there. You had mentioned the December 21st. Just by way of background, the CDC, in working with CVS and Walgreens and MHA, had in those discussions received feedback that, remember, the nursing homes had until I think December 7th to make their final election on contracting with Walgreens or CVS or MHA for these distribution programs, and then they had to scale. And so they asked us to be sure to give them, or in those discussions it came about, to give them headroom to be able to just get the logistics and operations established. But there's no prohibition on distributing and vaccinating sooner. In fact, we encourage it sooner if Walgreens, CVS, MHA are ready to go faster. And as the General said, we expect to see vaccinations in nursing homes this week. And literally by next week, these pharmacy chains should have the ability to execute vaccination programs daily in thousands of long-term care and assisted living facilities and progress quite rapidly. Thank you. Next question, please.
Thank you. Our next question comes from Evan Brown with Fox News.
Good morning. Thank you all for doing the call today. I think this question might be best for the General, but anyone can answer it. It was mentioned earlier in the call that there could be hiccups in distribution because nothing is ever perfect. What would some of those hiccups actually be that you might have anticipated, and what would be the remedy for those, and how intense would those hiccups be?
So I think that we've worked through many situations, and I'll give you a couple here in a moment. But they can be everything from as small as the addresses that were sent in weren't specified correctly. I'll give you an example. Fort Collins, right? The address that we double-checked, I had people working on it because this was a situation identified, had F.T. Collins versus F.O.R.T. The system is so delicate that, it needed the exact clarity. There was 2 spaces in another state, I forget which one, major city. Instead of saying the part of the city and then the second part of the city, there was 2 spaces, which the machine couldn't identify. So that is one. We've been identified. We're working through it. We know. We set up teams to manage that. So that's way over on the left. Way over on the right could be anything as catastrophic as an accident on the highway with a truck or God forbid, a plane, etc. So all the way on the right. Then in the middle, we have things like, I know you've seen the weather report. There's a storm that's coming into the northeast corner here on Wednesday, Thursday, and Friday. There's a major storm in the northwest that's coming in Tuesday, Wednesday, and Thursday. And so anything from, weather that could help, could be a problem. The other thing that we're working on, and it's a constant, the reason why we developed the strategy of the initial pushes and then the continuous drumbeat is so that we have the right people at the right places doing the right work. You need the dedicated workforce preparing the boxes that know how to do it, right? This is the most valuable asset we have right now, and we don't want people overtired. We don't want new people coming in. We want the right people doing the right things. The same thing with truck drivers and pilots. I read somewhere this weekend, we've extended beyond this and beyond that, their normal hours. Absolutely untrue. We created a steady drumbeat so that it is a predictable execution and the right people are in the right place at the right time to prepare and deliver the vaccine. So we're working a myriad of potential things from all the way to the left to all the way to the right to the center. My responsibility to deliver safe and effective vaccines means get ahead of that problem. So we're constantly thinking, where do we need to, where could we possibly be vulnerable, and how do we mitigate it?
Great, General. Thank you. Evan, thanks for the question. Next question, please.
Thank you. Our next question comes from Elizabeth Weiss with USA Today.
Hi, thanks so much for taking my question. I wanted to ask about delivery to rural areas. The focus has been at larger medical centers in this first week. When do you anticipate it's going to get out to less populous areas?
General, you...
Sure, Mr. Secretary. So I'd reference it back to the states, right? We're enabling the states' plans in their priorities and distribution. We can deliver it to any place that there's an enrolled vaccine provider. And that is, quite frankly, as we did the map, is throughout all of our states, territories, and megacities. So the capacity exists to do that. Many states are already engaging and working with partners like CVS, Walgreens, and 17 other key pharmacies to help them expand. But at the end of the day, we're enabling their ability or their plan to execute their priorities.
Yep. And Elizabeth, just on your question about rural distribution, again, the governors are in charge in terms of where they tell us to ship to. One misconception I get asked about a lot by the media is the Pfizer vaccine and the ultra-low cold chain around that. I just like to, the Vice President and I met with Governor McMaster and his health commissioner last week down in South Carolina, and his health commissioner, she had a great line. She said, we're not going to be storing this vaccine, we're going to be using it. And so we can ship the Pfizer vaccine to rural hospitals, rural health centers, et cetera. It comes packed in dry ice, 5 days stable, a refresh 5 days on the dry ice there. The more complexity actually with Pfizer is that it comes in 975 doses per package right now, whereas the Moderna will be more flexible, smaller package size, and of course also regular freezer for storage capabilities. But there's nothing in the nature of the Pfizer vaccine or distribution that prevents use in rural. Just want to make sure you use all those doses within the relevant time frame. So thank you. How about the next question?
Operator, next question, please.
Thank you. Our next question comes from John Cohen with Science Magazine.
Thank you for taking my question. In keeping with the Secretary Azar's commitment for radical transparency, could you please post a dashboard that has real-time supply and delivery information Can you reveal the exact ingredients the Secretary said Warp Speed provided to Pfizer? And can you give us an accurate amount invested specifically in vaccines by Warp Speed?
So you broke up a bit. We certainly are releasing the information about our contractual commitments as much as we are able to, consistent with the Procurement Integrity Act. There are obviously some elements of it that are commercial confidential that we just legally aren't able to, but we've tried to post our contracts and other financial commitments fully. And we are also going to be working to provide a dashboard and information to be able to ensure that you and the American public are able to see the progress on vaccination as we go. I know, General, if you've got any update on what that will look like.
So we created the system. There is no system in America that existed until we came together to bring in all the authoritative data across the country into one system. So now we do have the system, and we can see ourselves as we are executing the beginning here. We are really just making sure that everything tracks. So there's a lot of double phone calls to make sure this says this, and it's very good. And then after that, then I see, based on guidance, we'll distribute it accordingly.
Great. Thank you, General. Can we have the next question, please?
Thank you. Our next question comes from Carl O'Donnell with Reuters News.
Hi, this is Carl. So I was curious just if you can elaborate a little bit on the facilities from which these doses are going to be shipped. You know, not just this first tranche, but maybe the first 25 million or so that we've been hearing about from Pfizer. Is this just going to be the U.S. facilities, and is Belgium also going to play a role in providing supplies?
General, are you comfortable talking about that?
Yes. So the primary doses for Pfizer come out of Kalamazoo, and that is where they will produce and distribute it accordingly. We did get some initial doses from Belgium to help us get going to meet the requirement as we've made with Pfizer. It really is approved accordingly by the FDA. It's only the way we're allowed to distribute it, but the remaining vaccines I see coming from inside of the United States as we go forward. Same thing with Moderna vaccine when that eventually rolls, and we'll distribute it from inside the United States.
Thanks. Next question, please.
Your next question comes from Lisa Krieger with Mercury News.
Yes, thank you for taking my call. So it's great that the East Coast immunizations are starting this morning, but can you tell us if the West Coast shipments have gone out, when they're arriving in San Francisco, Sacramento, and LA, what the status is on vaccines headed out here?
So they're all deliveries will be made today. I was told no later than 1,400 hours local time, right? As we're working through the time zones and distributing accordingly. So I suspect somewhere in the next 4 to 6 hours that it'll be out in the West Coast locations, if not already there.
Thank you.
Great. Thank you. Next question, please.
Thank you. Our next question comes from Meg Terrell with CNBC.
So I'm wondering if you guys can walk us through kind of what to expect from Moderna if it gets emergency use authorization around the same time. What are the differences between how the Moderna vaccine gets shipped as it is part of Operation Warp Speed versus how we've seen the Pfizer vaccine get shipped? And could you also talk a little bit about why there are so many more doses of Moderna's vaccine available now and they're going to so many more locations?
Yeah, so just in terms of Moderna timeline, as Dr. Slaoui spoke about, Meg, the advisory committee is on Thursday, and assuming that everything remains on track, we would hope and anticipate FDA action comparable to what we've seen this last week with Pfizer. No guarantees, but we would certainly hope the comparable timeline. The biggest difference, which General Perna can go into, is Pfizer and Moderna are both part of Operation Warp Speed. Pfizer chose, however, because of the ultra-cold chain storage, to ship directly out of their warehouse facilities using FedEx and UPS to the sites that the governors have asked us to have shipped to. whereas Moderna is using McKesson, the wholesale distributor, so they will deploy from the Moderna manufacturing into, they will deploy through McKesson, also using the logistics companies like FedEx to get the product out there. But General, you want to give a little more detail on that?
No, Mr. Secretary, you got it exactly right. Pfizer, just as you said, to lessen the transition with the ultra cold, went right from their locations to UPS, FedEx, and then final delivery. Moderna chose, and we supported, they're going to use McKesson as their integrator. So they'll take the fill-finish product, they'll package it in accordance with addresses and quantities, and they'll attach the ancillary kits, and it'll be finally distributed down. Again, it was just a logistical decision to ensure just a greater transition as we went through. So really no big secret there. FedEx and UPS are the key integrators of the final delivery down to the final location. Reference the cadence, let's just, for this conversation, assume we might be on some type of similar timeline. Our goal would be for the Moderna product to be available this time next week across the United States. So Monday, Tuesday, Wednesday, a drumbeat vaccine of the initial push being sent to all states across the country. Reference the quantities. The difference in quantities is about what was available when we were doing planning to ensure initial delivery. So as early as, I'm going to get my dates wrong, but as early as 15 November, I had to snap the chalk. I snapped the chalk line on what was available for Pfizer so that states could do planning to the number. As we were sending out the first doses, we wanted them to have as much time to do planning and realize where they wanted it to go first. And so I snapped the chalk line on what was available at the time, which was over 3 weeks ago, and that's what went out. Well, I didn't have to snap the chalk line for Moderna until a week or 10 days later, as we saw where they were in the process. So they naturally accumulated more vaccine available for the time of final distribution, which allowed me to almost double the availability from Moderna over Pfizer. The key is that we catch up in our following cadence and allocations. There is no exact number. It's a number that's available, and that's what's allocated, so that we can ensure a flow of vaccines going out consistently to the states.
Great, thank you. Next question, please.
Thank you. Our next question comes from Candace Choi with AP.
Hi, General Perna, can you explain what the dashboard you referenced will be showing? Is that going to be distribution? Is it going to be uptake? And is it going to be broken down by region? And then also you referenced the 581 shipments from Thursday through the weekend. Are those part of the first round of 2.9 million doses, or are the 2.9 million doses all being delivered through Wednesday?
So the latter question first, it's the remaining part of that, right? So states are ordering to their priorities and where they want it first. And as they did their initial planning, they wanted it in very certain places up front to do certain things. Then they quickly, as their plans, matured, wrong choice of words. As they enacted their plans, right, then they immediately went in and ordered more to follow on. So we got the initial push, and now we're in a continuous effort from there. This is what we want, so that vaccines go to the right place at the right time and can be executed. The first part, dashboards, I know it's maybe sound complicated, but we do this in Army Tactical Operations Centers all over the world. We do it in every time we're on the battlefield to when we're actually training. It is about seeing yourself and understanding what is happening so that you can identify and get ahead of problems and make sure that the plan is working accordingly. So, we're looking at everything from the dashboards are the work we've been tracking trials. You heard Dr. Salawi talk about how many people are participating in trial. We're tracking locations where trials are and what the enrollment is and what the type of enrollment. Then we're tracking manufacturing. We know all 25 facilities. We know how much work has been done, how much people is there, what their supply requirements are, what their equipment use is, what is the rate of execution, so that we can track and see all of that. Then the last dashboard is the final distribution. It's our ability to know what's available, where is it available, what is actually moving from point A to point B to point C, and when does it arrive at its final location. And then, yes, we can track uptake of vaccine, not by individual, but by quantity of what has been administered, daily, weekly, monthly, accordingly. We want to do this so that we can ensure the right flow of vaccine at the right time to the right places in support of the states. Again, reminder, this dashboard has never existed in our lifetime to do this type of national view to really mission command execution from development, trials, to manufacturing, and now final distribution.
Great. Thank you. Next question, please.
Thank you. Our next question comes from Tom Howell with Washington Times.
Hi, thanks for doing the call. I know it's early, but have you had any problems yet that would require you to tap into that reserve of 500,000 doses? And also, do you have a rough estimate of how many people might get vaccinated nationwide today? Thanks.
So absolutely no situations that's required me to tap into the safety stock. And so, we manage that, hourly, daily, weekly, accordingly. I don't know what the uptake would be, Mr. Secretary.
Right. We'll have 2.9 million doses this week, but that's really going to be a matter of the progress of the different sites for administration and how quickly they're able to administer vaccines. So it would be impossible to project any particular number for this week or even today. Next question, please.
Next question comes from Alicia Alt with Medscape Medical News.
Yes, thank you for taking my question. My question follows up on the last one a little bit. I'm wondering, General Perna, if you can tell us if there are any plans to hold back any of the Moderna vaccine. Yes,
There is. I mean, it's the same situation. It's two different vaccines. We're not going to of course, like that's a decision. The two vaccines have to be treated separately. So first and second dose Pfizer, to an individual, first and second dose for Moderna. And our goal is to make sure that all vaccine is available for both first and second doses. And then the safety stock, as I alluded to, would be to mitigate a situation that could potentially occur, whether it be weather, accidents, et cetera. So, yes, the answer is we are. Not asked, but I'm going to share. This is about making sure we're prepared to mitigate situations. As our process matures, both in manufacturing and in distribution, as I've said before, the safety stock will go down significantly. Our goal, the guidance I've been giving, is vaccine sitting on a shelf is not effective. Right? We have two vaccines that are highly efficacy. The efficacy is high, and we want to get it into the American people. We're just taking prudent steps to ensure that the American people have access to the vaccine first and second dose, and that we remain capable of ensuring everybody across the United States gets fair and equitable distribution. Confidence will grow every day and allow us to reduce the safety stock accordingly.
And I wanted to also explain something that's come up in some media questions around the holdback of vaccines and the approach, given that this is a two-dose regimen on both the Pfizer and the Moderna vaccines. So As the General has explained, for both Pfizer and Moderna, certainly in these early weeks of distribution, he's taking a bit of safety stock off the top. As he mentioned, the 500,000 on Pfizer, half of that safety stock there, just for contingencies unknown. And then distributing out to the states where the states have asked us to send half of the remaining doses. So that's where you get to the 2.9 million doses of Pfizer being distributed this week. One of the questions that's come up is, well, should you be distributing even more of that vaccine to get first dose vaccinations in people? Well, we've actually modeled this out quite carefully week by week based on the expected release of additional production from both Pfizer and Moderna. Here's the issue. We need to make sure that if we vaccinate someone a first time, that we expect there to be a vaccine for the booster on the 21st day or the 28th day, either from a held back supply at the federal level or from ongoing new production from the manufacturer that would credibly be releasable and available for that person on that date. The clinical trial studies are for the first dose plus the booster. The data shows that's what's needed. That's what we have to be able to support. So if we increase too much the number of first vaccinations in December, you not only have to be able to provide the booster in January, but you have to be able to continue first dose vaccinations of ongoing populations. So you're managing a flow of first and second dose vaccinations as well as a flow coming from manufacturers, which, as the General's talked about, we're manufacturing protein biologics here. And so you want to make sure, especially in the early weeks of production, that you build enough safety into it, because you want to make sure you get to a point where there is a rhythm and predictability on the quality of manufacturing and lots that are coming off. So that's what we've managed to. We are pushing to the maximum the number of people to get vaccinated. Obviously, that's our priority, is getting as many people vaccinated as possible, but we do have to be able to ensure there's a second dose available either from what we've held back or from realistically expected ongoing production. So that's come up. I wanted to give that clarification. If we could have one last question, please.
Thank you. Our last question comes from Sharon with New York Times.
Thank you for taking my question. General Perna indicated on Saturday that 20 million doses would be distributed by the end of the year. On Sunday, Dr. Slaoui gave a lower number of 14 million. Which is the right number? And if it went down, can you please explain why?
I explained that 20 million people will be immunized. I always said that.
Yes.
In the month of December, before the end of the year. I'm not sure about the 14 million. Maybe the 14 million is actually the order of magnitude of number of doses coming out of Pfizer or Moderna. But between the two, there will be enough vaccine doses to immunize 20 million people in the month of December and give them a second dose in the month of January and immunize an additional 30 million people in the month of January.
Yeah, just to be clear, with all three of us sitting here, by the end of December, we believe there will be enough vaccine distributed to get a first dose vaccination for 20 million people. Then, as Dr. Slaoui just said, by the end of January to add another 30 million first dose vaccinations. And then by the end of February, we actually believe we could have 100 million vaccine shots in arms that will have been done between first dose and booster shot vaccinations of individuals. And as Dr. Slaoui has said, by the end of the first quarter, by the end of March, 100 million actual individuals who have had at least a first dose vaccination. Correct, Dr. Slaoui?
Yes, actually, we plan to have 200 million doses of vaccine by the end of the first quarter, so by the end of March, which would be enough to have immunized 100 million people. And depending on the performance of the Janssen's vaccine and the AstraZeneca vaccine phase 3 programs and emergency use authorization, we expect a significant number of doses potentially from the Janssen's vaccine in February already, and even more in March.
And of course, as a single dose regimen, those are vaccination equals person vaccinated at that point. So, yeah, so that's why we are so confident in the flow and the vaccine schedules that we've talked about, but I think very consistent in what we've tried to present to you all. So we will continue to do these briefings. I'm going to be going shortly to GW Hospital, where I'm going to get to see several of the first individuals getting vaccinated, our heroic frontline healthcare workers here. I want to get to see them getting vaccinated and see the process underway. Very comprehensive program that GW Hospital set up to organize and allocate vaccine among their frontline healthcare workers. So we'll be doing a lot of that this week as our leaders try to make sure that the American public see our complete confidence in the process used to get to these vaccines, to have a credible scientific determination by the FDA, and encourage all those who are designated by their state's governors to go ahead and get vaccinated, please. So thank you very much. And Caitlin, if you want to close us.
Thank you all very much. Please send in any follow-up questions to our press office at media@hhs.gov. Thank you.